Now, just a really quick video on how we humans should be protecting ourselves. And again, I don't have an abundance of these where I can send, but I'll send 2 sets of these medical exam gloves, and then 2 of these surgery masks. But I would say first, let's go ahead and put on. Again, I've washed my hands with hot water and antibacterial soap, or use chlorhexidine or chlorhexaderm if you have that. It's actually better on your dog's skin if you have that to use instead of rubbing alcohol, but rubbing alcohol uses fine or works fine, because let's face it, we're not going to be doing this every day of the dog's life, just right now. So these gloves are one size fits all, and they truly are one size fits all. Now when you put this mask on, you're gonna feel the top and the bottom. On the top, you're gonna feel there's kind of a different texture there, and what that is, it's a small piece of metal that allows you to bend, and you're gonna see why in a minute. Very simple surgery mask. It's over your face, over your nose, behind your ears, under your glasses if you wear them, and then pinch right here on that little metal piece that you'll never feel it, but it's inside the fabric, the cotton or whatever that is. And then you're ready to rock and roll. Now, equally important, when you get home, how to properly take these items off. I'm going to start with your mask, and I've got a waste basket right behind the camera. And then I don't care if you're messing with Ebola or the flu or pig flu or what. If you're going to go to this effort, do it right. So don't grab at the edge of the glove, because you're just going to be cross-contaminating your hand again. Everything you've been trying to protect, you'll be contaminating. Grab right here, and you're going to go inside out with that, and then we put that glove in that hand, and we're going to repeat to an inside out, to where any contagions are actually inside on the other side of these gloves, because they're inside out now, and into the waste basket, where that will get tied up and taken outside. I hope this short video has been useful. Of course, once again, when you take those gloves off, and for that matter your face too, you can use Dial or Ivory or whatever, as long as it's an antibacterial soap. Make sure you use the hottest water you can comfortably stand, preferably some type of washcloth, and lather for a good 1.5 to 2 minutes under the hot water with the soap. You can even use antibacterial, Dawn, Palmolive, whichever brand you prefer, dish soap. Just make sure you get a good lather going. Get up under those fingernails really well, and all the cracks and crevices. And I like to say to go up at least close to the elbow, if not over the elbow. Really, that kind of depends on what you're wearing. But then rinse thoroughly, dry, and frankly, to do it right, the last step would be to take everything off. Sorry, but take everything off, jump in the shower, and rinse off. And again, wash with a particularly antibacterial bar soap when you do that. And don't miss anywhere, get everywhere. Coronavirus is particularly threatening to individuals over the age of 60, as I understand from the research I've done. As I also understand, it is affecting both cats. I'm sorry, no, I haven't heard about cats. But the coronavirus in cats and dogs are related. And as I understand, I remember from my clinical years, we dealt with coronavirus by way of parvovirus in dogs and coronavirus by way of panleukopenia in cats. All that's to say is, this absolutely it's jumped from domestic pets, I don't know, by way of bats, by way of Lord knows what, how viruses do what they do. I'm not a microbiologist, but it has mutated now such that it has become a threat to the human species, and we have to act accordingly. I hope this has been helpful. Love you.